Okay, okay.
Uh,
Proceed.
so, um, like it so happened, like the doctors, there were two OB-GYNs, like who were performing these C-sections and all. All of a suddenly, they started like thinking that I am their biggest enemy. I'll tell you why. They used to keep mothers ready for the C-section and all. It so happened one incident. I have 600 births to tell because I have assisted almost 600 births in the period of 5 to 6 years. So there are like almost all kind of births I have attended, be it twins and be it big size babies and be it IUGR and VBAC and a lot many all kind of births I have attended, and I feel very proud, like they were all in a natural way,
Yeah.
and the biggest challenge for me was training the staff, like who
Mm.
the earlier also I was telling you, like it was like since I can say since so many years, since so many decades, they had the typical kind of a practice, which they were undergoing and they were doing it. Like it was pitos and births most of the time, and not so very respectful births and all. There used to be lots of abusing in the labor room and all. And one more challenge, which I was seeing was, the myth, one time C-section is always C-section. That was the biggest myth. And people, women, mothers, I can say, like their families somewhere, they didn't want to listen what I was trying to tell them. And there is a social pressure on women here in Kashmir, of having a baby boy. That's
Mm-hmm.
the biggest
Yeah.
pressure here in Kashmir. In Muslim community, that's very common. You need to have a baby boy, and for that, and Kale, what I used to see in the OPDs when mothers used to come, for the first time, mothers, like their mother-in-law used to come with them, their husband used to accompany them, and with the second child, no husband, and like either her sister will come or her mother will come, not her mother-in-law. See,
That's
well,
interesting. That's very
and
different.
yeah, and I started observing these things and all. And when they used to come for the second time, they are definitely under a pressure if they have a baby girl for the first time.
Mm-hmm.
Okay. Then their reports, like their hemoglobin used to be like not so good, and
Yep.
maybe because of the stress kind of things they used to undergo, having a pressure of giving a baby boy, that kind of a thing. And for the third birth, trust me, Kale, nobody used to come with them. They were all alone, and the Asha worker, if you know who the Asha worker is, like
Mm-hmm.
she used to accompany and all. Then the point of their mental health came, because for the third time, how it is, like if they don't give birth to a boy, then definitely her husband is gonna get married again.
Mm-hmm.
That was kind of a thing, like which was like bothering me somewhere. Then I
Mm-hmm.
started working about their mental health as well. There were so many things, like all together, like then gradually, like after 2016, I can say, I became a district trainer,
Oh,
training these nurses and all, for the midwifery thing and all. So it again started with the training, I can say, which I went to attend one. As a government doctor, they sent us for the trainings and all. And there was a pediatrician who was talking about a delayed cord clamping, so which I already knew. And the simple question from my side was, I my problem was I used to ask them lot many questions. That was the problem for them.
yeah, yeah.
And like I kind of asked them, yes sir, what you are saying is absolutely right, but what is the evidence behind, what are the benefits behind? And for my surprise, the pediatrician didn't know about it,
Mm.
whereas I knew. So the journey of becoming a district trainer started like this, that then in that particular training, I explained a few things which I had learned. And it's so, like it's so started, like everyone, oh, good, 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 you can teach these things. Then from 2016, I'm working also as a district trainer, and I train nurses and midwives and paramedic staffs and all those things. Now, I would like to tell about one birth. Like there are so many births, Kel. If I'm taking much time, then I can stop.
No,
I
we're
tell you
okay.
much
You
of
know,
the
we're okay because somebody else was going to talk and she's not going to talk tonight. So you're going to take your slot. So that's cool. Go on.
Okay,
And
fine,
I
fine.
think I believe you might be very helpful for Riddy and Gory too. I'm not sure. Is Mama and Hale, is that you, Gory? But anyway, for sure, I'm very appreciative of what you're saying. And I think you could provide some inspiration. I feel like you're inspiring these others.
Oh, so sweet, so
Yeah,
sweet.
no, for real, for real. So keep going, keep going. It's okay.
I remember a birth story. There was first time mom, and I was luckily, like in these 5, 6, 7 years of not 7 years, I can say after 14 definitely, but 2008, since 2008 I've been working as a labor doctor. I've been lucky to be the in charge of it. Like I could change whatever I wanted to change. I've been really lucky that way. So I remember like a first time mom, and she was in labor and with good contractions, and her relatives were, kind of, they wanted to bring her into the labor room, and she wanted to get out of it. She didn't want it to come to the hospital. And I just was like, what is the problem, what is the problem? I kept on asking her, but she just was telling me, I don't want to come in, I don't want a hospital birth, I don't want to be here. That was the only thing I could hear. And in between the doors, we were taking her in and she wanted to go out. It was something like that.
Yeah.
And in between that, she pushed hard and the baby fell down. I can say, not really fell down,
But came.
but
Baby
the baby
came.
came out. In that, the baby came out. Then somehow, like in the standing position, you can say. And we just took the baby and like we did rest of the things and all. After a while, like when she was lying down and she was quite calm later on, I just asked her, what was the reason you didn't want her to come in? What was it? Like she said, I wanted to give birth at home. I didn't want her to come to the hospital. Then I asked her, what is the reason? Her co-sister, like somewhere in her family, who has given birth in our hospital, the government hospital, she was hit badly in the labor room.
Oh, yes, 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 yes.
That
yes.
was very, like unpleasant kind of an experience, which she had
Yeah.
shared with her. She had shared with her, and she was so scared, to come in and give birth on the particular table. And
Oh.
there is, there were so many things, Kel, like with every birth, it was totally different. With every birth was different. And like now I'm so very happy, like around I guess around 100 ANMs, like you can say nurses I have trained, and all of them are practicing natural birth.
Right. That's perfect. Perfect.
And I remember, like 2018 has been like a really bad year for me, I can say, because by 2018, from 2014, 15 to 18, I had made so many enemies, and the biggest enemies of mine were those two OBGYNs, like who used to do C-sections and all. Believe me, Kale, I was literally thrown out from the OPD.
Yeah.
Not
Yeah.
to sit with them, not to talk to any mother and all.
Yeah.
Believe me, I used to attend them in the corridor. the area where passerby comes and goes, and
Yep,
like that kind of
yep.
area. I sat there for 1.5 years. I sat there and I have spoken to mom, and like I have possibly motivated. I have visited almost like I had visited so many mothers. I used to go in villages, door to door, just to check whether they are good and not. And like there were women like who never used to come to the OPDs and all, for the regular checkups and all. I used to get the information from the ASHA workers, and like I used to go to them, to their places, and talk to them and discuss their problems if they have any kind of things and all.
Yeah,
These were kind of things, like I have done in my own capacity, which I could have done, possibly the better way. Now I'm happy with the things I have done. I'm happy now, like with the things I have, like I'm working as a district trainer, and like doing things,
that's
like
great.
now. Sorry.
That's great. That's great infiltration.
Yeah, kind of. Now I'm really happy with what I'm doing, and the old stuff like like the nurses which used to which knew the typical way of the hospital way of birthing and all that. Now they have changed. Even they are like they believe more in natural births, and the broken table is still there, and the blunt scissors are still there, but we don't need them anymore.
Indeed, indeed. Oh, that's wonderful. That's a wonderful heroic story. Totally. And should I, there's many women here who are doctors like Riddhi and Gauri and Harini, and who are in this institutionalization, are being confronted by the same situations you've been confronted by. And
Yes, yes, yes.
and suffer when they have to confront a doctor and things like that and pull them up. So now you're like a hero. And in Kashmir too, so this works out very well. So no, that's lovely, and thank you for joining us, and thank you for sharing your story, and thank you for being there for the women. This is
Thank you.
really, really, really good, and being honest too, because you mentioned the beating, and I saw some things I cannot believe could occur for women in labor, that they could be beaten with sticks, bamboo, I forget what they're
Oh,
called, the little bamboo sticks,
yes, yes,
whack.
yes.
And for no reason, they're all, you say small labor room. These women are all squatting against a wall, and the nurses come by and just randomly whack them just as they're
Yes, yes.
squatting, just this whole thing. Unbelievable. And slapping them if they make noise and giving birth, and some other weird ass.
Exactly, exactly. This
What
is
was
what I have
this?
seen.
And what's
Mm.
this other thing I saw? It was every birth where they grab the labia majora, right? The fat bit in there. And when the baby's crowning, they like to pinch and twist.
Oh,
Pinch and twist. What's that? But
Pinch
this
and
is
twist the baby, Kian?
no, the labia majora. So that, in the,
oh,
yeah. So
Oh, the labia majora. Oh.
yeah. And what's that about? And it's every woman. And of course, I even in some of these rural hospitals, every woman was getting an episiotomy. But this could be after, if the baby was already delivered and arrived, they'd give the episiotomy anyway. They cut the episiotomy after the baby.
no.
Just because apparently you're supposed to have one. And they're very upset if they don't get one. So then they cut it. And then they don't use anesthetic stitching it up.
This is what I have seen in our labor room as well.
I mean, and yelling at the women for crying.
Yes, yes. I have seen this. I have seen this.
I would like to add something.
Yeah,
Yeah.
please.
When Shagufta was sharing her story, I was like, oh, I've gone through the same thing.
Exactly.
Yeah. I worked in the government. I think Shagufta, I've met you in the
Yeah, in HRIC, we have met.
conference in Mumbai.
Exactly, exactly, exactly.
Yeah. It's raining here. It's a beautiful day today. Yeah, it's raining
It's
since
cloudy
11.
today here, and it
Uh,
may rain by evening.
It's pitch
I just
black here.
so so I have so see I used to have issues with the doctors, with the facilities, like broken tables, broken labor beds, broken, stuff, then insufficient mm, uh, medicines when needed, like if they need an
Exactly.
anesthesia, it's not there, it's not available, you have to ask
Mhm.
for it.
Oh,
You have,
that's interesting.
you have to ask for gloves. You have to ask for gloves.
Exactly.
Yeah. The first thing, I used to go to the labor room in the government hospital. I used to look for gloves and put it in my pocket,
Yeah.
because when in need, I will not. It's like a 5-10 minutes of you know discussion, and
Yep.
like asking for it. So I thought, either buy my own, or if they are available, come first and take it. So
Yes.
I also got a pack of sterilized gloves in my bag, and I used to enter, look around, hunt for them, keep them in my pocket.
Yep.
Yeah. And so I used to have a lot of issues with but you know what, Indian population, and the poor infrastructure of hospitals.
Exactly.
uh, the women are not supposed to be blamed. The doctors are not supposed to be
To
blamed.
be blamed. I agree with you. I
The
agree with you.
staff, the nurses, they're not supposed to be blamed. The problem is the government,
Sector
definitely
itself.
government wanted to work on high maternal and infant mortality rate. I agree, but the way it happened was not the right way.
Correct.
they
Correct.
they did not study they did not study the population. They did not study the infrastructure of the hospitals. They just made a rule in 2011, which is Janani Suraksha Yojana,
Yojana. Yeah,
which
yeah.
says that the births need to be in the hospital. So they
But
started.
Riti, somewhere
2011. Thank you for that.
I just feel, like, the OB-GYNs, they took it completely wrong. Hospital birth doesn't mean C-sections.
I'm not saying that, Shagufta. What I'm
Yeah,
saying is,
yeah.
my what I wanted to go ahead, the vision I wanted to show was, the hospitals were not ready for so many mothers in
Exactly.
labor.
Yeah, yeah. They still are not ready.
They
They
are
still
still,
are not
yeah.
ready.
So it's been 10 years. Labor rooms are not added. The beds are not added. Staff has not increased. The same numbers of doctors were doing birthing of 5 to 10 mothers in labor. Now they are handling 100 mothers in labor.
Hundreds.
What
Exactly.
I'm at one time, yeah. So what I'm trying to say, how can you ask for patience? How can you demand so many things when let's say if I have to do 10 homeworks in a day. We are not meant for that. Birthing is not a business.
Yeah,
birthing
it
is
is not.
birthing is not something that is timed. But because they didn't have time, this is what happened.
Yeah, yeah, yeah. It is
So
Well,
completely
also
medical.
because birth doesn't belong in a hospital anyway.
Yes,
yeah,
yes,
It
yes.
doesn't belong in the hospital. It
it
should
doesn't
be
belong.
only for emergencies or complications and problems. And if you're honest about it, that's only 10%, 10% max of your population need to
Yeah,
be transferred. So
I
then
would say
your
one.
hospitals can cope. If
I would say one to
they can
ten
cope
percent.
with it, but they
Yeah,
can't cope with it now, not if you're going to make every woman, there's a hell of a lot of you, go
and
into
also
these understaffed, underfunded, undereducated systems, which are dealt on frustrations. Really,
No,
everybody's
what I
frustrated.
could see is, it was complete medical impatience.
Yeah,
It is complete medical
exactly.
impatience. That
I wouldn't say. I would also add, Shakufta. As you said, it was an incomplete It was a
medical
incomplete
impatience.
It was a medical impatience. Also, I believe. They didn't. You know how we have an issue. I feel there's an issue with we being an Indian. We don't. we don't appreciate, we don't like our heritage, our culture, our, we always look down upon ourselves. It's so
I hear
unfortunate.
this. I hear
Yeah, and it's so unfortunate. We always look at, I was always in awe of US and Americans. And when I went and stayed in US 1 year, it took me 1 year
and
to
you
understand
ran.
that I am so much better. I am so much grounded. I have somebody to look at. I have family. I have care. I have unbroken, I have a good family infrastructure
You have a
where
good
my,
culture. You have a good
yeah,
culture.
yeah, my mother is married to one, and she doesn't have extramarital affairs. I don't have to deal with that in my life. And
Exactly.
I took it for granted, unless I went and saw the other side of the world, where my friends of my age are talking about they don't want to accept their mother's boyfriend, and I was like, oh my god, that I I,
Oh.
I was like, what do you mean? You know, for me, it was such a and I was like,
We
are they,
are best
do
ones.
they
We are best ones.
do they share the same bed? And they were like, what do you mean? I was,
And Riddhi, like in these years, I have realized one more thing. Like we can't blame doctors completely. We can't put the 100% burden on doctors
we
of the
have to take
C-section.
we have to take the
What
blame
I
on
have,
ourselves.
what I
Shagufta,
have seen is,
every mother on its own. See, people come to me they say, let's do home birth, let's do natural birth. When I go into what they're eating, how they live, how they
mm,
conceived, what they know about birthing, how I say, no, we are going to a hospital and I want to secure myself.
oh,
Yeah,
Mm.
because
exactly.
unless and until you work on your body will not support you for birthing. This can be
Exactly.
this is like, like the in thing now, natural birthing, water birthing.
No,
Yeah,
though it
they're
is
very,
very in thing here in Kashmir, I can say, because it's been almost 10 to 12 years I'm working here. What I am seeing nowadays, women are kind of fantasizing this thing, like just sleep for 1 hour and under anesthesia, like, when you get up, you see a baby besides you. And like no labor pain, nothing. They don't have to go through that harsh kind of a thing which they have heard, or they'll be experiencing what they have heard about. The
uh,
problem is they don't know about the pain management kind of a thing and all. That is one more reason, I guess. Like, Kashmir is JNK, as a state, Jammu and Kashmir, it is on the top. Like when we Google it, for the C-section rates and all, Kashmir is on the top. Kashmiri is on the top, and there are so many reasons. We just can't even completely blame doctors. Of course, there are doctors, who are doing it unnecessarily. I completely can understand if it is done in a corporate hospital, like in a private hospital. If it is done, I can understand they are doing it for money's sake. But why in government hospitals? I don't understand that. That
because
was my problem there.
I
I
tell you
I
why.
start.
I tell you why in a government hospital, because they don't have time, they don't have
That
beds,
is what medical
and
impatience.
Shagufta, they are looking for a job in a corporate private hospital. They want to, they want to practice,
Balance both the things.
they want to practice hands-on C-section so that they
Mm,
can get a good job.
job.
Mm.
Yeah. So you have to see, okay, so coming back to the Indian culture. I'm sorry, I went into the funny aspect of, we have forgotten we have forgotten who we are. We were so we 5,000 years back, India was beautifully spiritual and beautiful space to be.
Yes, yes, this is your
Yeah,
true culture. This is your
yes.
jewel.
And
Diamond. Yes.
my ancestors have been, I had unrooted myself, and few years
Mm.
back I realized I would love my son to have the culture and the sanskar. I don't know what it is called in English. Sanskar.
Nobody, only India has some scar. This is Indian. I don't know what they say in English because they don't have it in English. It's Indian.
So when I realized I was not, so the only reason we moved back from US was I just said one thing to my husband: I am not strong enough for I'm not strong enough a mother to accept that my child will grow up to be an American. I want him to grow up an Indian and then go anywhere he wants to. But those
Okay.
initial 17, 18 years, I would like to cub him in India so that he sees family around. He sees, relationships around. He sees, roots of our culture. I won't
The
be able to
essence,
give
the
him.
essence, yeah, the roots of your people, your culture,
Yeah,
your
right.
country, your wisdom,
Yes,
the
our
true
food,
you.
our food, our ancestral knowledge.
Yes, food,
That
food.
that's when I decided. That's when we were like, okay, let's go back. Yeah, and uh, I think we have forgotten that. I think we had so many Gurukul system where the kids used to live in a teacher's home. Not even call that person a teacher, was a guru. Was a saint, maybe
Mm.
a
Mm.
priest, and
Shishya, Guru
yeah,
Shishya. Mm.
yeah,
Yep,
guru
yep, yep.
shishya. Yeah, and it was such a wonderful relationship. And then we had these convent schools. English is not our first language, but you look at the children today, they don't know how to speak in Hindi.
No,
Yeah, Kale, their
no.
mothers their mothers don't appreciate if they talk in Hindi. It's my son who talk in Hindi. It's my son who will eat with his hands, and he's been mocked at.
This
It's
is a
my
big
son.
mistake. It's a big
It is.
mistake. Don't
It is.
lose your language. Huge
Yeah,
mistake.
we are.
I
we
don't like hearing this. This is very
Yes.
bad to hear.
So what are we promoting? We are promoting English everywhere, in all banks, in all hospitals, everywhere. If you don't, especially if you go to a private hospital or a corporate hospital, every form is in English. Even the consent form has to be signed in English. When I
English.
told them,
Bad.
yes, when I told them, listen, this the couple doesn't know English. Can they write in Hindi? And I can sign it, and they can sign it. They were like, no, you are supposed to write in English, and then they can sign it.
Wow.
And I really felt bad for the couple, just because they had a complication and they couldn't get into a government setup, they came to a private one. But they were looked down upon at every stage, just because they didn't know English, just because they didn't wear clothes the influenced people wear.
Yeah,
and
yeah,
i feel
yeah.
and I feel the moment we're going to come back, and I think I spoke about this in the I almost speak about this, because I came you know I went back to my roots only because of my child. Unless
Mm.
I was also derooted. I was also influenced by the Western accent and culture and
Mm.
fast food. Yeah, so
Yeah.
I think we are going to come back, and then we're going to tapasya. Yeah, tapasya, we would love to hear your clinical.
Yeah, Tapasya, I would love to hear from you.
But I think we need to come back. We need to work on our midwifery wisdom, the dai wisdom we had,
Mm,
professionalize it. Yeah, and
yes.
then I think that's what we are doing as physicians here. We are connecting to our roots and understanding what our ancestral birthing was like.
Yeah.
Like my husband was born at home with the dai.
Yep.
Yeah,
Yep.
Mm.
Yep.
all
Most of
my
you are. I reckon all of you would have been.
yeah. So we connect to yoga, we connect to farming the way it was done traditionally and not the way it is done now. We connect to our education system the way it was done then and not now. I think then every mother can birth their own baby. And then the
Exactly.
physicians will, even when I realized that, moving forward in 10, 20 years, um, people will be connected to their bodies. Because when I started connecting, that's how you also understand. I know people around who are like me. So when people like us increase, then the
Yes. And
then
support
then
each
Definitely,
other.
definitely.
yes, and support each other, and how
Yeah.
they connect to each other. and then the physicians also will have to look at differently.
And you
And
guys, you're in a wonderful position because you are a physician. So, you know, you
right,
do have the ability, and that's why I say Shagufta is a good inspiration for you, for many to move forward, and
yes,
it
yes,
can be done. It can be done.
and
Yeah.
and if we have support, like I need support. I always keep saying that, okay, I have connected to the wisdom of birthing, but I still know, I'm still finding out ways and how can I do it.
Well, it always comes, it's constant. It's never that you find it all. You will never know it all.
Yeah,
You will always be learning, and you will always need to learn more.
right,
And to understand, it's actually your mothers who teach you.
right,
These are the teachers. And the
right,
births that you sit at, these are the
right,
births, these are your teachers. And you
right,
learn on the job, you know. And, I've had to replace uteruses that popped out. Now, I never got to see this, it doesn't happen often, but it
right,
just shows up. Oh, so there's my teacher right then and there.
right,
I've read about it, I heard all about it, so I know what to do. And
right,
there you go. And this mother in this birth shows me how to do it. And
right.
and so with this, I shall introduce Tapasya.
Mhm.
And Tapasya and her hematoma. Are you there, Tapasya? I have it set up so that when it's time,
Yeah,
I
yeah,
can show
I
the
am
picture when
there.
you're ready.
Our kids are again going crazy.
Oh, the kids are going crazy. Okay,
Yeah,
okay, tell you what, I'm just gonna put the
yeah,
picture up, and
yeah,
I'm gonna mute you
yeah,
because I
yeah.
hear your kids going crazy. I'm gonna put up the picture, hang on. Where'd you go? Where'd you go? You're here. Can you guys see that? I don't know if you see that. So there's that hematoma that Tapasya sent us. And I'm gonna go back and turn that off if I can figure out how to do that. Oh, it didn't say share yet. Anyway, did you guys see that picture? Yeah, from Tapasya. I'll try it again. Hang on. Oh, there. All right. You can see this, yes? All right. So in answer, or to explain, I don't have this whole story. Tapasya did call me, send a message. And so there is this woman who had, I believe in second stage, this hematoma shows up. Tapasya is wondering,
Yeah.
go,
Actually,
go.
this is my client. She wanted a homework, and I mean, she had her work, but not at home. But yeah. So what happens is her labor kind of starts on and off for 3 days. Sunday night it starts. Sunday whole day it's going on and off, but not consistent contractions. So I just leave her alone. And on the Monday morning, her husband calls me at 6 a.m. and tells me that the contractions are every 10 minutes and they are pretty consistent. And this has been going on from 2 a.m. in the morning. So I say, okay, I'm going. I go there. The contractions are consistent every 10 minutes. Then they die down. Then again, they pick up at around 9. Then they die down. Around 12, I say, you just eat and rest. There's not much. We are just following the pattern and seeing the pattern that your contractions pick up for a while. Then you need some rest, some nourishment, and then they pick up again. So call me in the evening. I'm sure this night the baby will be born. And I come home. I also eat, take rest. In the evening, 6 o'clock, 6:30, the husband calls again that contractions start again every 10 minutes, and the mom is saying that he should call me because she's thinking it is close, and so I go in. Still, I haven't done any vaginal check. I want to do it, but she has told me that she doesn't prefer it. So I'm just following her labor, and by 7, I'm sure that she is completely dilated because the heat has reached the knee, and she's showing signs of little bit of pushing sensation is there. Transition, she's going in very meditative, cool and calm. Okay, then I again make her drink a little bit of juice. She's having pushing sensations. She's pooping. Um, so yeah, on the jugs pads, we're fine with that. And she's using a lot of on all four position and making little pushing efforts. Till then, it was everything was okay. It was till then it was like 8:39 p.m. Uh, I wanted to have a look at the vulva because when you're ready to push, it the vulva kind of bulges because all the blood comes in there, and I can see her perineum stretching a bit, um, like the usual changes that we notice on the external genitalia when the baby's coming into the birth canal. I still don't do any vaginal check. By 10 and by 11, she's actively pushing. The blood is some blood is coming out, but still I'm not seeing any signs of baby on the perineum. So so I asked her, do you want to change the position? Then she gets on her left side, and after a while she says the head is there. I'm like, no, head is not there. So what I see is the water bag bulging like a small balloon there, and it's black. So I know it's the meconium is there. But I'm not worried because I listened with the Doppler. The baby was sounding fine. The variation was good. So I'm like, okay. So yeah, water bag is there. Baby will follow soon. Do you want to break it? Do you feel it's very difficult to push with the water bag? And she said, yeah, I might as well break it. And she just pinches it with her nails and it breaks, and some meconium comes out. And then we are waiting that, next 3-4 pushes, I should see the baby. But instead, I see this bulge. And she's saying that I is that the baby's head on the left? And I'm like, no, that's not head. So I get her on the birth stool so that I can look what it is. And I'm seeing this bulge. So I said, I need to check. I need to go inside you because I've never seen something like this. I've seen, perineum opening slowly, then the baby crowning. So I insert my fingers. So baby is a little bit above, like 2 fingers above. Inside the vagina, baby is not on the perineum, and this bulge is kind of it's bulging. It's arresting the baby's descent, but baby is there. I listened to the heartbeat again. Baby is sounding fine, so I'm not worried. But then the blood loss starts. It was bleeding. So I called you. You weren't
What was bleeding?
picking up. So
What exactly was bleeding?
I don't know from where the bleeding was coming.
Okay.
Because it was
And how
like
much
a
bleeding?
very
How much?
little slit. Little bit like normal bleeding, not much. But then it picked up. So what I was thinking was baby's head was kind of pushing on that bulge, and it was leaking from somewhere. I don't know. So I call my mentor in US. She says apply heat and cold alternatively. But I'm thinking I should not apply heat because the blood is already accumulating. Maybe cold would help. But I never got to get the ice because the husband said, this doesn't look good to me. We are going to the hospital. I don't want to wait. And I asked the mom, what do you want to do? She said, have you seen anything like this before? And I said, no, I haven't. And I really don't have a clue. Maybe I can push it up, and you can push with the contractions, and the baby will be born anyway. The baby will push it. And she did that a couple of times, but she says, no, the surges are not that strong, and I don't know why, but I don't want to push. And I said, okay, we'll just trust your intuition. What do you want? She said, let's go to the hospital. We go to the hospital, and the drama starts. You know, what is this lady? Why was she not in the hospital? Why was she waiting for so long? And I'm trying to explain them. One of the doctors says, she doesn't even look pregnant to me. I'm like, what? Yeah, because she's a tall lady, and I was following the growth
Oh,
of the
tall
baby.
women. Okay, that's a common thing. If you're tall, you don't show
Yeah.
so much. If you're short, you pop out.
and and if the baby had descended so much, it was almost at +1, almost, why would she show? Because the shape of the uterus is going to change. She is at the stage of labor where she is not going to show so much. The baby is not up there.
Mhm.
So
Well, baby looks descended to me. I mean, that the shape of that parent, not just the hematoma, but the pressure upon the anus. You can see that. So baby's descended.
yes, yeah,
It looks like
baby's
he's right
almost out,
behind this.
almost out.
Yeah, right
That
behind this
hematoma is arresting
hematoma.
the descent, actually. So, and they are like, where are the papers? So I show them the report she had sent me, etc. We don't know what blood disorder she has. I don't know if she has clotting disorder. She'll bleed to death. We don't want to do a C-section. I was like, yeah, okay, that's good point. You don't do a C-section. Yeah. Okay, what can we do? So one sensible doctor says, you know what, we can give her local anesthesia, we can push it in, she can push out the baby, and then we can incise it and drain it, and we'll just suture it. And I said, okay, that sounds like a plan. So I think that they agreed upon that C-section was not a valid option because baby was almost out.
Yeah, it would
And
have been horrible.
yeah, taking out that engaged baby out is
Horrible, horrible.
worse. Yeah. So they thought, okay, let's give it a chance. So they gave her a local anesthetic. Baby came out. Baby needed resuscitation,
Mhm.
but they did it wrong because they cut the cord immediately.
Yeah.
So the baby needed more help, obviously. If I was at home, I wouldn't have been scared. I knew baby was in little distress because it was not able to come out. Okay, there is a helicopter. Wait a minute.
Is that her urethra? That's not her urethra, is it?
No, it's her labia.
Yeah, but at the top, I can see the whole bulge, and I know it's the labia that's bulging. But is that her
Yeah, it's the
urethra at
labia
the
that's
top
bulging.
there? Is that the
No,
clitoris? No, okay.
no,
Okay.
the clitoris was inside, urethra was inside, the labia was bulging. The bulge
Okay,
was
okay.
most on the lower side.
Actually, that looks okay. So it's actually the clitoris, not the. Okay, okay.
It might be, yeah. So so the baby was born, baby was fine. They gave her a blood transfusion, thinking that that if that hematoma bursts and she loses a lot of blood, but she clearly didn't need that transfusion.
Tapasya has twins.
Horrible children ever.
But that's what the background noise is, just to explain.
So I have seen something like this, yeah, and I I have seen this couple of times in the government setup also, and the private nursing home I was working. So it started with a small bulge, and what I did was I inserted my two fingers inside,
Mhm.
where I was so the baby's head and my fingers was in between of both the cervix and the labia, and then the swelling decreases,
Ah,
and then yeah. So but I had to I had seen a senior doctor, senior OBGYN doing this. Yeah, and when I asked her, why have you insert? This is in the government hospital. She stood there for 2.5 hours because she saw a swelling coming up at the vulva region. So she said, if I don't, a hematoma will develop, and it might uh, restrict the baby, the head uh, exit entrance, the exit.
Yep,
So
yep.
she kept standing there for 2.5 hours, and I kept standing with her. And then I gave her a stool, and she sat, and we kept discussing. And I saw the swelling going low. Swelling was still there,
Mhm.
it not increasing. So and then I saw two of these at the nursing home where I was there, and I with one I did the same thing. I inserted my fingers inside, and I stayed for a few hours, 2-3 hours, and
So where are you going? What are you doing?
so basically insert the finger, and so if I feel the cervix, so this is where my finger will be. So the head,
Yeah. Okay. Oh,
so the
I'm
head,
always up here, but
yeah,
okay.
yeah. So the head doesn't knock on the vulva outside.
Okay.
Yeah.
So wait, you're putting your finger on the side where the bulge is beginning to prevent or just trying to get pressure off this swelling. Is that what
Yes.
you're doing?
Yeah.
Okay.
Just trying to get the pressure off the
Yeah.
women, making them
I,
also making the women go, the mother in labor go in
Knee
uh, the
chest.
the knees chest position.
Yes. Yep.
Yes. And so basically, when the mother is on the knee chest position, my hand finger will go like this and not like this because
Yeah.
he is inverted. Yeah.
Yeah.
And um, putting it in a way which is parallel to the vulva.
Yep.
Yeah. So let's say if this is the opening, I will insert the fingers and put it like this. So the pressure goes off that place, and the head hits my hand.
Mm-hmm.
So
And your hand can move too to allow, you can actually push. This is kind of what I do. My hand is the other way though, but the same thing where I'm just trying
right.
to stretch. And this is one of those times where, well, actually, sometimes you can be in there and cause the problem. And I've done that. Or this is the kind of thing I've done. So when I've seen this too, that's exactly what I've done, where I got in there and kind of held it back. It may even get kind of big like this, but this is what you do. You hold it back. I've used ice. I've used in the knee chest position and a lot of lubrication. But you're saying, Tapasi, too, is that your woman did not have a pushing urge, which is interesting. And I can only assume that the bulge prevented her from feeling it, or what? That's all I can think, is that it just, I've had this,
And
yeah.
I would also like to ask you, Tapasya, how much time did it take for this hematoma to happen and for it to grow this big? And what did it look like in the initial phase? Just from the
yeah, that's what I think I should have done. An internal when that bulge formed of amniotic sac, because that's not something normal. It was like a balloon that is pinched, and
right.
I should have known that okay, something is going on. So I should have done a check, and I could have arrested this, like inserting my fingers and using some ice. But by then it had swollen a lot.
Yeah.
So and again, I don't have that much of experience.
Yeah. No worries.
So
No
yeah,
worries. No worries at all.
yeah.
Um,
So
mm,
okay, so the way it ended was fine for everybody. Everybody was happy, and even the mom is happy because they did it without episiotomy. It was surprising.
Yeah,
They didn't want to cut an episiotomy to not to harm the hematoma, but she got
yeah.
a suture, but everything went fine again. But for the learning point for me was, even I'm reluctant to do cervical checks. I think a couple of them should be done if I see that labor is deviating. It's kind of not consistent,
Hmm.
and something like a water bag bulging, and still even after breaking it, maybe not coming down. I should see what it arresting. Is it the synclitic head or something like this or something?
Precisely.
So
Yeah.
yeah,
Yeah.
yeah. So that I learned, and then yeah, of course, that made me think: should I do an internship somewhere with there is a volume of patients? Because I don't know, my practice is pretty low, 2 or 3 births in not in a month even. And right now though it's really low. But 2 or 3 births in a month, it doesn't give you that much exposure. So I was just
Well, it
thinking, should
builds
I?
up, it builds up, and you have to, all I can say is, I believe it's a journey. I believe it's a journey. You may not, but I mean, I'm following your heritage, your philosophy. This is I've adopted your philosophies. Um, you're following a heritage. You're following, oh, what was it? I was losing it too. What were you saying so you're only doing a few births a month. It'll grow. You will learn along the way. Again, as I say, the mothers become your teachers. And I believe it's kind of a blessed journey, let's say. It's a destiny, let's say. And
That's true, but I don't want to learn at the cost of others.
you're not learning at the cost of others. Well, but you're not in control of that either. That you don't get to decide how you learn this. This is how it is taught. And tell you what, you're not getting it out of schools, are you? You were very fortunate to learn from Wapio and the system that you were following. You were very fortunate to learn, get a good foundation. Whereas Ridi and Shagufta are having issues with their foundation. What they're being taught is, they're trying to drag the knowledge back up. So, you're not in control of how you learn this. And this is what I'm kind of saying is I feel that this is a spiritual journey almost. Forgive me for saying that, but I just feel that I just feel the lessons come to you by God when it's time. And your mothers are there who teach you. And here, pop, there's a hematoma. Now you know what to do. And you had a good outcome. You had a great outcome. And again, I guess, I'm a devotee, so I have this understanding that God's in control. So always I can always beat myself up and say what I did wrong. I did this wrong. But at the end of the day, and this is your heritage, and you guys just said this yourselves. This was what you guys said. You want to tap into your ancient knowledge and wisdom. And this is what I grabbed onto during my journey. And this is that God is in control. Not a blade of grass moves without Krishna sanctioning it. So here,
That's true. And actually, you know what? In my midwifery program in Matrona, we talk a lot about trusting your intuition.
yes.
And all the time I was meditating uh, about this birth. I meditate a lot when a client comes up after prenatals, etc. But nothing in my meditation came up as a problem or a complication. It never arose.
Mhm.
Generally, if there is going to be a problem, I have a hint. But with this, I didn't have any intuition of problem. So the problem was not there. Just the place of birth was not destined to be her home. And something I learned is not to attach myself to the outcome.
Yes, yes,
And
yes.
everybody was safe in the end. that I knew, because I kept asking my guru, is there a problem? Is somebody is in danger? And nothing could come up. Nothing would come up. So I'm sure, like I'm not going to blame myself because I didn't do anything wrong.
Correct.
I just used the first steps of wise woman tradition, and not the last step, that break and enter. I didn't want to break and enter. That's fine, because that was my limitation. I didn't have the right tools. And again, I was a little worried that if at all this hematoma breaks, or baby needs help, or if she loses blood and after again she has to deliver her placenta.
Yeah, 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 yeah.
So that was a little bit of concern. So what I think whatever followed was for everybody's best. The only thing is
Including you.
I want to
Yep.
learn more about this. And when you have a clinical experience, when you work at a hospital or a birth center, you get that volume and you learn from experience.
Mm.
And this is looks kind of limiting for me because I don't see that much. And even my apprenticeship was home birth midwife, so it was 3 births at max. So it's kind of, yeah, that's what I feel is my limitation, as opposed to doctors who see a
No,
lot of
there's an
doctors all the
advantage. You're seeing the limitation that you're on a slower conveyor belt. But I promise you, these in the hospitals, there's a lot of because it is all the stuff is coming at them fast. As they're saying, they can't really deal with it naturally. As I said, I remember when I got to my first 100 births, and I was talking to my sister, and I was saying she was doing her residency. She was doing her OBGYN residency at the time. And I was bragging how I just attended my 100th birth. And she said, "Poof, I did 100 births in this week." Wow. So yeah, the numbers are there, and they might see more, they run across more issues, but they create a lot of more issues too. And they're also having, once so many of these doctors and nurses and whatnot come out and feel they need to be untrained or unbrained, they need to wind back the cloth and get the reality. So just, there, and again, once again, you're not in control. You don't get to control, here, they're not in control. Rudy and Shagufta are not in control. They get what they get. And then they have to go reach and learn more. So similarly, you get what you get on the natural basis and the organic level, but you're still going to learn, and you're always going to learn right up to your very last birth. But you're in a different classroom that has special teachers that these guys didn't get. So just accept that and learn from each other.
And
Here they are ready to support you. So you can share, and you're there to
there was
support them.
something I learned
Go.
as well, that if this all was going on in a hospital setting, if there was a natural birth friendly or an experienced doctor that like Riddhi had, she would have allowed things to proceed.
Yep.
But in the setup we have, it would have been a C-section right away, because they didn't want any risk to the mom or the baby, because at the site of very meconium they would have just taken her totally. The good thing that happened was we labored at home as long as, because the plan was to work at home. So we just didn't go. So I know that, like, when the setup changes, you don't have control and you don't learn the way the things are organic. So I'm happy to learn in this way as well.
Yeah.
So, yeah. So
And,
because
and
in
I'm
that
so
setting, I could nourish her. We could use some meditation. We could use different positions. But in hospital, that wouldn't have been possible.
and also Tapasya, the fetal heart rate, you kept saying the baby was fine. Yeah. So just because you were home and you were able to nourish her the way you are saying, even if the hematoma happened, and it is a good big size hematoma, it did not. Yeah, I agree. Baby needed some resuscitation. It was also because of the immediate cord clamping, right? We would have given some time to the baby and things would have gone much better. Yeah, but the baby was fine, and even the mother was fine. Her vitals were okay, the blood pressure and all that. So I feel if this hematoma would have happened in the hospital, she would have, yeah, definitely gone in for a C-section right away. So, so waiting even in this blood clot for the baby to descend would have happened at home, and also the travel time it took for you to go to the setup. So that's also, yeah, that's also what I've learned today, that we can wait.
Yes, you can wait.
Yeah. Yeah.
Including, you can wait for the hematoma, you can wait for the labor, you can wait
Yeah.
for your education. You're
Yeah.
being educated every step of the way.
Yeah.
And you're teaching every step of the way too, so it's all good. Or Tapasya, look at her.
Yeah. I am able to smile today because my son went to see, he's playing at the farm. Otherwise, I also turn off my video and I'm actually, it's the same face.
She turned it off just in time.
Yeah.
She turned off her camera and her mic, and she's yelling at her kids now, right? She's
Yeah.
yelling. And where did your kid get that mop of hair? What beautiful hair your son has. I want to rub my hands through it. There she
Welcome
is.
back, Shagufta.
It's your child. What were you two? Oh, look at this. What were
Oh.
you doing? What were you doing? What are you doing to your mother? Oh,
They want to play outside,
okay.
get the hose and spill water everywhere, and they're cutting grass. And
Okay. It's okay, Tapasya. They need you. And I know Riddhi probably wants to cut it short anyway. So, look, we were talking about doing it 2 days a week. We can do it a little shorter then and make it easier if you prefer that. We do have we will start this week again, the organizational meetings about getting the organization up and moving. And I think Shagufta and Riddhi would be good for this. Yeah.
Yeah,
Yeah, I
absolutely
think
fine.
so.
yeah, I think we should give some priority to organization as well. We can have
Exactly.
academic topics every twice a week, but for right now, we should dedicate one meeting to the organization.
Yes.
We need to organize ourselves, otherwise
I
it's not
agree. I agree.
Yeah.
Help each other. And it's nice to see. It's nice to see more.
ये देखो, ये आपके बालों को कर रहा है.
I like your hair. I want to run my fingers through your hair.
Thanks.
Hi, how are you?
I'm fine.
Oh, it's so good to meet you.
Thank you.
Okay, ladies, I know it's early, but it looks like everybody's lives are demanding. Does anybody else have to add anything? Do you want to say anything else?
Had a birth story.
Oh, where's Sereni?
She was here now. She's here.
I know, but she left a while ago. Does anybody else have anything they want to share?
I just had a question about the same hematoma. So
Yep.
Tapasya, you said that, so you went to the hospital and they gave a local anesthesia, and I mean, can you tell me in detail, and then?
Then what they did was they manually pushed the hematoma in and let the baby to descend. And then they drained the hematoma because they were worried that baby might get distressed, and let's not lose the baby at the cost of mom. That's what they told me, that if she loses blood, our priority is, saving the mom. We don't know about the baby. Baby sounding good, but she's pushing against the obstruction, so she might be in distress. So that's what they did. Local anesthesia pushed the hematoma in because she didn't have this sensation, because when I tried to push it, it was painful for her.
Right.
So when they pushed it, she didn't feel anything, and the baby just descended. And then, they gave her a spinal anesthesia, the spinal,
Finally.
which they give for C-section. Yeah. Then they drained it. because it was going to take time.
I got it. Okay.
Okay.
Okay, anybody else? Otherwise, we can-
Tapasya, did they also give her Pitocin and Misoprostol 400?
Nothing. No need was there for that because baby was already so low.
Yeah.
Baby just came out, and after that, I think in the delivery of placenta they did because they didn't let me into OT. But obviously, that is the third stage management, the standard one which you guys do.
Yeah, so I was asking about the
I'm sure they
postpartum.
just took her placenta, gave her pitocin, gave her stitches, antibiotics, all the routine.
Mm. Anybody else? Who's Mama Hale? Is that Peru?
And that's Rubia.
Rubia. I never tell people apart.
She's from Coimbatore.
Does anybody else have anything to add or share or whatever? Okay.
Did she sit in? I'm sorry, I'm having questions.
No, do it. Keep asking. Ask as many questions as you like.
So Tapasya, did you ask her to, or did she want to sit in the water when she was feeling the urge to push? And
No, we didn't have water. We didn't have the pool. Her plan was to go on land.
I'm just wondering what if, if there was water around and
How that would help.
Even I think water could have helped. Yeah.
One of the
Yes.
problems with the water, that it's a good idea with the water in terms of you're thinking of buoyancy and supporting and lifting things. But the problem is usually the water is hot, right? It's warm water. So this becomes a problem, which is where you have the ice packs, right? Which isn't going to work under hot water. I've done the knee chest and stuff and pushed over with the knee chest. And as you say, just basically moving the bulge over, just kind of lifting it up and out of the way. It does seem to usually be, have you seen them anywhere else but in labias? I've only seen them in the labia. Yeah.
Yeah, me too.
Okay.
Yeah.
Um,
Maybe near the clitoris once.
oh,
Yeah, but that was a swelling. Yeah.
yeah.
Which can be confused for the urine retention, but it's way below the bladder.
Mhm.
And that goes off with just pressure on it, direct pressure.
Right. Okay.
So so that also happened once. And so if this is the clitoris, pressure where you cover the opening
Yeah.
and just put your hand there. So we also used a tampon. And so this happened in the government hospital, and I had a DNB student. DNB is like an MD here in India. So
Mhm.
student. So what we did is we got a tampon and we put normal saline on it, and we put the tampon, then a hand and put pressure, because that area, if you put ice cold water, it it's very sensitive, that area.
Can spasm.
So yeah, so we use the normal, and instead of using a gauze, we not inserted, but like inside, but not inserted.
This is for the clitoral one, is it?
It is for the
Clitoral swelling. Yeah.
Yes,
Yeah.
but the clitoris didn't get swollen. The area
Just
around.
near around it on the sides.
Yeah.
Because the
You can
baby's
say,
leaning, coming down on the top. Yeah, on that.
so if this is the clitoris, this is the clitoris, this area.
Yeah.
Just under.
So the baby's
around.
coming to the heart. Yeah, the front
Yeah.
coming forward instead.
Right.
Yeah,
Right.
yeah.
So I've seen that also.
And also you can just
any
which
guesses
hazel?
why that develops? Why this kind of hematoma might
As the
develop?
baby descends, he blocks off the return. And then also the tissues in the vagina and around also swell, right? So it's not just blood. And there's a lot of capillary action going on and blood flow going on. And during pregnancy, and especially during birth, there's even more blood flowing going on. And this, you know what this is about? It's about allowing the cervix, it oxygenates, throws blood into the area, the perineum, to allow it to stretch. And this is, you know, this is part of the process.
And
So
also, if the
yeah.
baby is coming faster and the cervix is opening slowly,
Yeah.
slower, and also if the baby, you know how the baby, if
Delays in the descent, you mean?
yes, yes.
Yeah.
So if baby's descent is faster compared to the opening of the cervix,
Yeah.
compared to the dilation, then also it can happen.
Because
And if there's
yeah.
Yeah, that's what I was thinking, that uterus didn't have, that much force, the tone which we call
right.
during the contractions. The contractions were powerful, but she was in active labor, but she was not having,
The
as
urge.
powerful contractions that she be having, because 1 minute contractions, very few. 30-second contractions, more like 3 to 4 30-second contractions, then 1 minute contraction. And I put my hand on the belly to see the strength of the contraction. I was feeling that it's lacking strength. I should use some homeopathy, but she
Well,
didn't want
again,
to take
it's doing
some
this because
halothane.
the uterus is recognizing there's an obstacle. It's not going to just keep ripping into itself. It's allowing opportunities, waiting for it to all come together and resting before it's going to do it.
But we don't know, the obstacle developed because of uterus not pushing that hard and cervix not opening, or it developed later and the
Well, it's
uterus
a
understood that.
combination, but we do know it's a
So,
combination of the
yeah.
baby descending before it can, the blood, it's things are happening faster than other things can amend for it, allow for it. So again, these things show up and they're always a little bit different, and you kind of have to learn about the body, learn about anatomy, learn a bit about a physiology. So for instance, you look at this hematoma, what do you need? You need hot, cold, except the heat. You're worried about the heat, right? And you know why you're worried about the heat. You mentioned the water and you had an issue, you were concerned about the heat of the water. So this intelligence is coming through as you understand how the body works. But in addition, there's witch hazel. Witch hazel can be used for these types of swellings. We mentioned the ice pack. Oh, chamomile tea. So this is actually, I learned the hard way. So I mentioned one time about, I've mentioned before about using perineal compresses, hot compresses. And that you need to put chamomile tea in it or something that's astringent. So if you just use hot water on a stretching perineum, there is a possibility, and I did see it happen once, that the perineum started to swell because of it started absorbing the fluids from the cloth I was putting up against it. And then this becomes a problem, that the whole perineum swelling because I've added hot compresses to it. And I could actually see the bubbles running in the tissue. I could see a bubble, a few bubbles running through of swelling. So after that, I learned I always put chamomile tea in my compresses, and this prevented it. It never swelled up again. So these are some things that I do keep on hand, by the way, and they're part of my birth kit request to have these things on hand. And that's how I would address it.
Yeah, so I need to study my wise woman herbal a lot.
Oh, you're on a journey. You're on a constant journey.
Oh my God.
And they say, you don't stop, and you can't stop because things change. Things change. The world changes. I was just talking with my friend, and we were talking about how in the 80s, people were having their babies naturally. And I recently saw a gynecologist, and I said, how many kids how many kids have you had? 5. What procedures have you had? None. Wait, you've had 5 kids? Yeah. No interventions? No. I had them at home, and he was really surprised that I could possibly have 5 children without any procedures or interventions. So again, you're going to live and learn. These things will teach you. And you will always, always, always learn. You will never stop learning. You will never stop learning. And as long as you're practicing and out there working with people, you do need to continue to keep abreast, keep yourself informed. Always be willing to learn more because more information is coming out. Changes are always occurring. And if you're working with women and you're supporting them, you need, and they're looking at you as their guide. You know, it's part of your, that's part of the package I would offer is that I would, you know, keep studying.
I have a question about witch hazel. Yeah, so I don't know about it.
Okay.
Yeah.
Witch hazel, okay, and I'm not looking for the leaf. Witch hazel, you will find women use it as for their makeup actually, but it's actually a herb. It's a leaf, and they make a distilled water out of it. They distill it, and this is an astringent. So with hemorrhoids, this is what I use with hemorrhoids. After a woman has a baby, actually beforehand, it depends, you know, can't always do it in India. But part of my preparation or what women have in their homes when they're going to have a home birth with me, I get them to buy those little skinny panty liners, really thin panty liners, you know, and I'll do it. There, and and then I soak them, I saturate them. Oh, I actually asked them, when you start labor, have a packet of these panty liners and a bottle of witch hazel, and it's a bottle, it's like this and that way. And when I get there to the birth, I open up the package and I saturate all these pads. I just pour witch hazel, all of them. I pack it back up in a plastic bag and put it in the freezer. And after women have their babies, whether they tear or not, but especially if they tear, especially if they have sutures, especially if they have hemorrhoids or not, these women put these frozen pads on top of their other pads right after the birth, and they love it. They love it. And the cold helps bringing the swelling down. And this is another thing to pass you with that hematoma. You know, a lot of, even though we usually put women in warmth, the hematoma can actually be hot. The hematoma itself can be hot to the women because it's swelling with blood. And this tends to be a hot experience rather than something else. And so when you put the cold on it, they can appreciate it. So with this same thing I've never found any woman who didn't just love these frozen pads with or without the tears. So this is something I have on hand, and this is something I would have applied to this hematoma and to hemorrhoids. Yeah.
So this is what you're talking about, Kale?
Yes, that's it. There you go. That's it.
Okay.
That's it.
So yeah, got it.
Yeah.
Thank you.
Yeah. And just get those little skinny liners and
Right.
soak them and freeze them, and women love it.
Okay,
And then
please
after
show
that,
show them
they'll
again.
do it
I missed it.
themselves.
Oh yes. Oh, I thought you had.
No, I just Googled.
Good woman. See, we're geniuses. Any other questions, Rudy?
Yeah, so you said you mentioned two things, and the chamomile tea. How can we use
Okay, chamomile
that?
tea comes as a herb. So it's a
Okay.
flower. It's actually a small flower. But of course, I'm sure you can find a proper herb in your place.
Yes.
I have a feeling neem would do it. I mean, Savarna would know, but I just feel like neem or these things, you know, there's another plant that I can see in my mind's eye. But they strike me as being quite astringent, and they're antiseptic too, you know. They have their natural antiseptic qualities. But but I use I am familiar with and have easy access to chamomile tea. And chamomile is a small flower, and is a, not only is it a astringent, meaning that it decreases swelling and edema, it also is a calmative, meaning it helps you sleep. It's a sedative and it's a calmative. And I think it's a nervine too, meaning that it settles your nerves. It settles, it allows you to sleep. It helps you sleep. And it calms, it helps you sleep. It's an astringent like this. Yeah. So I would always, with water births, with water births, I just had a thing where I like to have chamomile tea and lavender, because lavender is antiseptic. It's also a nervine, and it's a heavy calmative. So this is beautiful in a water birth pool. So I would, in water births, you just pour this tea in there, and you smell the flowers, and people, it's just lovely. It's kind of a nice thing, and it's providing calm and helping that, preventing tissues from swelling, which can be the problem with the water.
So you pour it before, during, or after?
As soon as the woman's going to get in the pool, I'm
Okay.
happy to pour it into the pool.
All right.
And that's it. I'm happy with it at that. If
Okay.
if she's having a dry birth and she's not in a pool, and I'm doing compresses, and I was doing perineal compresses with it, which is
Okay.
just hot water and tissue and towels, or what do you call it, washcloths. And but I always had chamomile tea in it. So I would have made a very big, strong batch. When I got there, I would have made a strong batch of chamomile tea. And if it was water birth, I'd make lavender tea later and just throw it in. But for the perineal support compress mixture, it would just be the chamomile tea. You make a big, strong pot of it, strain it so the flowers are out, but you have a strong pot. So because when you're working with a bowl like this, it cools down quickly. So you're constantly topping it up. So then you want a strong concentrated tea so that you're constantly adding it. Yeah. That's what the hot water's for.
Got it.
That and boiling your instruments. Is chamomile tea for, no, it's put into the water itself. So they're not drinking it. They don't have to drink it, although they can later, because it does help them if women are struggling. And this is the other thing. If the mothers are struggling to sleep because the babies aren't sleeping, if the mothers drink the chamomile, the babies get it through the milk. So hopefully they all go to sleep together. But in this case, where we're talking about the water birth pool, or the perineal compresses, this is applied into the water, it's not for consumption. It's just applied to the perineum, or just added in the water. Yeah.
Okay. Thank you.
My pleasure.
I would like to leave now.
Okay, Rudy, thank you so much. Oh, thank you. Thank you for your input. Thank you for your questions. Thank you for your wisdom, and all power to you. Thank you for inspiring everybody. Thank you.
Yeah. Thanks, Shagufta, for your story. All right. Bye-bye.
Bye.
Bye. Bye.
Anything else, ladies? Any other topic to bring up or discuss, or questions? Okay. All right. So let's try, today's Friday, Wednesday. Let's try Friday for the organizational meeting, okay? All right. All right, I'll send out a link, and I'll resend the minutes so that we can kind of refresh our memories as to where we were. All right. Okay. All right. Thank you so much, and good night. Yes, it was. It was a very inspirational meeting. Thank you all. Thank you all. Oh, my pleasure. Thank you.
Thank you. Thank you.
And thank you for letting me see your kids. And thank you to
Oh.
Kostya for letting me tease you.
Thank you.
Sucks to be you.
Oh.
Good night.
Good night. Good night.